Welcome to Black Doctor Speak here on blackdoctor.org. I am Ellis Dean, a senior project manager with blackdoctor.org. And this show is our weekly show designed to provide you with the opportunity to hear important health and wellness information from some of the top experts around the country. The added benefit of this program is that you get the opportunity to ask questions and interact directly with our doctors and our experts. And so we encourage you at any point in time to leave a comment or ask a question. And keep your phones on silent as well. So,
that wasn't me, Ellis. That wasn't me.
That shows you that we are live, so we have all kind of things happening during this broadcast, but we're still here to bring you the best information possible. So as usual, I am joined by the best co-host since Vanna White, known as Dr. How are you doing, Dr. Karen?
Hi, good evening, gentlemen. So great to be here tonight.
So I understand you have a quote before we go to Dr. LeNoir. I understand you have a quote for us this evening.
Yes, this is Black History Month. This is the second day of Black History Month, and this is the time where we can just really magnify our greatness. So I have a quote that really talks about the strength and the resiliency of the Black community. And it's a quote by W.E.B. Du Bois in his book, The Soul of Black Folk. And it says, "It is a peculiar sensation, this double consciousness, this sense of always looking at oneself through the eyes of others, of measuring one's soul by the tape of a world that looks on in amused contempt and pity. One ever feels his two-ness, an American, a Negro, two warring souls, two thoughts, two unreconciled strivings, two warring ideals in one dark body, whose dogged strength alone keeps it from being torn asunder." So I just want to give a shout out to all of my brothers and sisters who continue to be strong and show our dogged strength, show our greatness in spite of people constantly trying to undermine us, oppress us, and doubt us. So kudos to us.
I almost feel like we can stop right there. I mean, you can shut the show down. I'm prepared. Like I really took me to it, boy. Thanks, Dr. Donna, for that. I appreciate it. And we can't
realize you were going to go so deep. What I do appreciate is if you look at 400 years and you look at the Middle Passage, where only the strong survived. I think we started with a great base for the African American community to build on, because I think we're stronger, and I think we've survived 400 years of experimentation, 400 years of neglect in terms of the healthcare system.
Yes.
Yet we still strive. We still survive. So really appreciate your comments and your quotations. I think that gives us all a little bit of pride, and I think that we probably can move on to understand that we have to do this. We have to keep striving.
Yeah.
Things haven't changed that much.
Nope.
So I think we need to talk a little bit about the coronavirus, a little bit about what we know now. Obviously, Donna, are you worried about the variants?
I'm not that worried about the variants. We know this is what viruses do, right? They mutate and they change. They're trying to stay alive, just like we're trying to stay alive. But from what I've read and, from experts that have said that even though the virus strains have, the virus has mutated, there's a number of other strains out there, that the vaccines that they created seem to still be effective against these strains because the protein has not altered that much. It's maybe small little particle piece here and there has altered on that spike protein. That's that red crown that we see whenever you see those pictures of coronavirus. That the proteins on that specific spike protein haven't altered all that much. So I'm still excited about the vaccine. We have a new vaccine coming out probably next week. What do you think about that, Dr. Mike?
Well, I think that it's a good vaccine, 85% effective, but most of the people who got the vaccine, none of them died and none of them got very sick. So I think that that makes it a critical piece of armamentarium that we have to fight the virus. I'm increasingly concerned though, Donna, because I keep seeing people talk about the fact that with these variants, you can be reinfected. And I'm not sure that we know quite exactly
Right.
how bad they're going to be. But what we do know that if you're not vaccinated once,
Right.
you're going to be these are going to be much more infection and much more dangerous.
Yeah.
What I am concerned about, though, is if you look at the numbers, the twice as many African Americans died, less than 5 to 10% of the vaccines have been given to African Americans. What are we doing wrong in our messaging?
Well, this is so that you had asked that question. I'm actually in the middle of writing an op-ed because that the title is Justified Distrust. Like, as we started out this show, we talked about over 400 years of medical and scientific abuse in the African American community. And so it makes sense that people have questions about this vaccine. Like, the medical and scientific communities, we have lost the privilege of just unadulterated trust, right? People should be asking questions. But I think the messaging is not that Black people don't want to get the vaccine. They want to get the vaccine. They want to survive. But it is that they have questions about the vaccine. So instead of us approaching it like, oh, Black people, you guys just don't trust anything, we really should be approaching it as, we understand you don't trust us, understood. But now let me tell you why you should trust us. Let me tell you what the science shows, what the research shows, what the studies show. And I think that if we approach it from a place of understanding, that we can probably get most of the people who trust us to trust the vaccine and get vaccinated.
Well, I agree with you that we can start from a position that says people who decide not to get the vaccine are unintelligent or somehow not really recognizing the real need for a vaccine. In fact, most of the African Americans I talk to, one group is have trouble even getting a vaccine.
That's right.
They don't know where to go. They can't find anything. I think the rollout has been somewhat of a disaster.
Absolutely.
For the African American community. But the other group says, look, I want to see what happens.
Mm-hmm.
I want to see what happens to you as you get your vaccine. And so I think that's a reasonable place to be. And I don't think that we as African American physicians should be criticizing anyone
who makes
a decision based upon the information they have.
Yeah, but kudos to you, Dr. Mike, because you have, put on social media when you got your first shot and then when you got your second shot. And so I think that makes a difference when they see us actually getting the vaccine. When I got my first vaccine, I posted that on social media. When my husband got his vaccine, we posted that on social media. It's important for them to see that we're not just giving lip service to the fact that we trust this vaccine, but we're giving it to ourselves. So I don't know any other way to show that I trust it more than, giving it to myself.
Ain't nobody loves me more than me.
Nobody loves me more than me. That's right.
If I could add one thing to that, we've done some polling at Black Doctor, and early on, back in April, there was about 63 to 66% of Black Americans that said they didn't want to take the vaccine. That number spiked at one point all the way up to 91% at another poll that we took. But the most recent poll that we took in January of this year, it was down to about 26, 27% of African Americans saying no. So that is another 30% that said yes, and the middle are still asking some questions. I don't have a problem with questions, and officials shouldn't have a problem with questions. When we're talking about something this serious and a vaccine that was created, in an expedient manner, not cutting any corners, but it was created very quickly. We do need to ask some questions. You need to be prepared to answer some questions, which is why we have this segment on this show every week, which is why we're doing another show next week called When, Where, and How about the vaccine, because we want Black people not only to be able to get the information about the vaccine, but be able to get the vaccine when they want to get it. And that has been a big issue that we have seen thus far with regards to the vaccine rollout, is that they're not putting it in the areas where Black people that might have difficulty getting information or difficulty getting transportation can get the vaccine. So if we want it, we need to get it to the people that want it so they can stay safe and protect themselves and their families. So I'm almost.
I would like to say one final thing, is that those of you who believe in the vaccine, you should be talking to your older relatives.
Yes.
One of the things that we're seeing now is that our elderly population is not getting that vaccine. And for them, it's a matter of life and death. So we need to move on into our program. I mean, with people who've been on the front lines, the nurses. I'm always intimidated as a doctor when I talk to nurses, because too often they know more than I know, and too often the patients listen more to them than they listen to me. But I think certainly Black nurses have been on the front lines since the beginning.
Yeah.
And we have the opportunity to talk to 3 Black nurses. Ellis, you want to introduce them, and let's go into our discussion on what their experiences have been.
Absolutely, absolutely. So first off, we have Marcy Fitzgerald. She is a nurse practitioner. Welcome, Marcy. We also have Sherelle Clark, who's also a nurse practitioner, and we have Alexandria Age, who is a registered nurse. So we want to thank the 3 of you for joining us here this evening. We do talk to a lot of Black doctors on blackdoctor.org, and of course, but we don't talk to nurses. And we felt it was important to really kind of talk to the people that are on the front lines, that are serving the population, treating the population. Because a lot of times, I'm going to talk as an end user. Many times, I spend more time with my nurse than I do with my doctor. And so I have to have that relationship, and in having that relationship, y'all see just as many patients as the doctors do. So we need to get that information from you all to see what are the patients telling you that they may or may not be telling the doctor, to kind of get some of that insight and really kind of talk about the experience of being a nurse in these kind of precarious times. So I'm going to shut up and turn it over to the more experienced interviewers. And
well, we don't accept that priority. But first, I'd like to ask each of you, what's it like being a nurse in the area of COVID?
Okay, I'll start. I'm not a nurse practitioner. I'm a regular bedside nurse. So I do work in the ICU. So that's critical care. So I've actually been in different places with COVID. I started off when COVID first started. I was in San Francisco, California, and it was really, really bad out there. So that was in the beginning where we kind of made like a COVID floor. Like we didn't even have a COVID floor. So we had to make an actual COVID unit where we would put the COVID patients. And me being on the critical care side of things, seeing like patients either start off on BiPAP or high flow and then get on the intubator. And, as a lot of people say, as you know, like once you get once you get ventilated, it's almost impossible to get off. Like it takes like a lot of rigorous work to come off the ventilator. So I actually just completed a deployment in Laredo, Texas, which is right on the Mexican border, and it was really, really bad out there. Like it was kind of traumatizing. Right now I'm on like a little mini break from COVID. So I work also PRN at a psychiatric hospital. So that's different as well. But I took a break from COVID just because it was so overwhelming, seeing so many people. And it's honestly for me, the obesity. And because I was in right outside of Mexico in Laredo, Texas, it was a lot of Mexicans, a lot of Hispanics, and a lot of them have diabetes and high blood pressure. And when you come in and you say, well, my mom or my dad or my grandpa, like, yeah, they have these comorbidities, and that's what's making it worse. So it's hard to get them off of the ventilator. We do have every once in a while a nice miracle, with what I call them, and they come off the ventilator, and then some of them have to be on oxygen for the rest of their lives. Some people are able to go to like different LTech facilities and become better. But like COVID is real. It's really out here killing people, and it's really unfortunate because people still are not taking it seriously, and it needs to be taken seriously for sure.
Yes. Yes.
I would say my experience is a little bit different because I work at a cancer treatment hospital. So we're a facility that has essentially outpatient and inpatient units, but we only focus on cancer patients. No one from the outside can come in unless you have cancer. So COVID for us it was almost like we were in an insulated bubble when it initially happened because the patients were still coming in. We were still giving them chemo treatments. And we were kind of functioning with life as usual. But as we got further into the pandemic, a lot of our patients started to be affected. We had a lot of patients calling in afraid because they're like, I have COVID, but I also have cancer. I want to get treatment, but we're like, we can't allow you to come into the facility because no one in the building has an immune system. So you can't come in here with an active virus and affect everyone in the building. So we've had a lot of kind of risk and benefit conversations with our patients. Like, yes, I understand that you want to come in and get your maintenance treatment. However, you don't have any active disease, and the risk of you coming in right now and sitting next to someone who's immunocompromised and in the middle of active treatment outweighs the benefit of you coming in. So I need you to just kind of take a step back, think about your fellow person sitting next to you who's also in the fight for their lives, and just have a little bit of grace and a little bit of, I guess, forgiveness for the person sitting next to you, because we can't let you come in right now. And it also has been interesting in seeing the patients that have been affected with COVID. My nurses have said that the ones that are taking the phone calls from patients, like they were getting, when the pandemic initially started, we were getting maybe 1 or 2 phone calls a week. Like, hey, had a close contact, don't really know what to do. What do you think? And now we're up to about 5 or 6 phone calls a day saying either I have COVID, someone in my house has COVID, what do you want me to do? And that is translating into the patient called and like, hey, I have COVID. And then maybe a week later, the family member calls back and says, we've lost them. They're gone. So we are pushing the COVID vaccine heavily with our patients just because we're like, listen, you're already immunocompromised. You already have an active malignancy. You need to be protected. And we're telling the caregivers as well, like, you're going to be interacting with them. You live with them. You need to be protected as well, because COVID is everywhere. And there really is no way that we can protect you from it. Even if you never leave your house, your family members have to live. So it's definitely been an interesting and yet challenging situation.
And I guess I'm kind of in the middle. Like Sherelle, I am currently a nurse practitioner, and just like Alexandra, I've been an ICU nurse and recall that time in the critical care unit. So I practice at a federally qualified health center. So I am serving our marginalized community, which is largely Black and Brown patients. And well, we have a lot of patients that have contracted COVID. I think every day I'm getting something in the mail that says, these patients have tested positive from the Ohio Department of Health, yada, yada. And I have, in addition to taking care of patients that have COVID, like Sherelle, I have patients that have multiple conditions. So I still have to take care of diabetes and hypertension and joint issues and everything else. So we have a lot of people that are hesitant to come in because they're scared of COVID. So their other conditions are advancing and not being treated. So it's trying to get them to understand to be protected from COVID, and they don't want to come in, but some things I can't address if I don't actually see them. So it's the back and forth and the tightrope, the dance of making sure that they feel safe and they feel protected, but still being able to treat their other conditions effectively as well. And our facility is offering the vaccine, and it's kind of a tightrope dance to get our patients the understanding and the knowledge to feel comfortable with it. Like Dr. Michael, like Dr. Donna said, it's providing them the science, but while acknowledging the part that the medical community has played in the distrust and owning that and trying to help them to understand, no, this is not that though. This is not that. And I did post when I received my first dose of the vaccine, and I'm due for my second dose next week. So I will also post that in social media. And the other thing that I have done is I'm volunteering with our health department to actually administer vaccines. So hopefully when our community comes in and they see me with the needle, they will understand that I'm not giving them anything differently than I'm giving the person in front of them, the person behind them, that I'm here to protect them. So those are some of my experiences and concerns so far.
Yeah, I can understand. I had prostate cancer in the midst of this. I wasn't a serious prostate cancer. I'm not terminal, at least I hope I'm not. But I know that what it was like going to the hospital, trying to get treatments, knowing that the coronavirus was around. Dr. Donna?
Yeah. So I just want to say kudos to you ladies for continuing to work on the front lines. I know it's difficult. I worked in the hospital. I'm a neonatal hospitalist. And so, being in the hospital during this time is quite an experience. So are you finding it more difficult for you to find that motivation to get up and go into work these days? How is it for you to get up and continue to do the work you were already doing?
I'll go first on that one. Oh, I'm sorry. Go ahead, Alex.
Oh no, you're okay. So originally it was like when COVID first began, it was more along the lines of, okay, I kind of have a bridge. Like sometimes I have COVID patients, sometimes I don't have COVID patients. But as we're deeper into the pandemic, now, especially me being a travel nurse, because I take travel assignments. So like I said, recently I was with Crucial Staffing in Laredo, Texas. So and that I work 6 days a week, 12 hours a day. So I had one off day, and my off day was on Thursdays. So I will always have self-care Thursdays, but I worked 6 days a week. So it was intense because it's literally you're always at work. It's it felt like I didn't know what day of the week it was anymore. All my days were running through. And it's really hard because the family members, with this pandemic, they can't be with their loved ones. So we're doing a lot of Zoom calls. We're doing a lot of FaceTime, and we're doing a lot of, trying to get everyone accommodated. And it's also hard to care for a loved one if you have a family member calling every hour, every 2 hours.
Right.
So usually we'll say, call at the beginning of the shift and at the end of the shift. So what makes it worth it for me is when I do have family members who cry to me and tell me how appreciative they are, they thank me. And then also what makes it worth it is when I get my patients extubated. That is a win for me. So that kind of keeps me motivated to get up and go out there and fight this disease, because I know that I'm making a difference. So it's without me, so that's what motivates me. It's I get up and I make a difference, whether it be in a patient's life, whether it be in my coworker's life, or it's a family member's life. So that's what motivates me to get up and keep going to work.
Great. I just want to highlight something that you said, Alex, because it's so important that people understand that the medical staff is not trying to be difficult or prevent you from talking to your family members.
Right.
But we're trying to care for your family members.
Absolutely.
And it's difficult if they're on the phone talking to you hourly. So it is important to set up some time, right? They call me at, 8 p.m. or 8 a.m. and I'm happy to give the phone, but there has to be
and
some
that's exactly what we do. So I'll talk to a family member and I'll say, hey, what time do you want to set up a Zoom call? We can do a Zoom call at 5 p.m., 4 p.m., whatever time, and then we facilitate, because we only have 2 iPads in the hospital.
Right.
So, other family members want to Zoom. So then another thing is okay, we only have 15 minutes, because they're well, I want to Zoom again, and I want to Zoom again. I'm okay, I know you miss them, and I'm sure they miss you too, but we have to spread the love between all the patients.
Thank you. Thank you. Sherelle?
I would say in the times that it would get difficult, because when the pandemic initially started, we were able to work from home and do telehealth visits. So I worked from home for about a month. And then we literally got an email on a Saturday like, hey, everybody needs to be back in the office on Monday. No questions asked. So initially I was like, oh my gosh, this is a pandemic. Like, I don't know. Like, I'm not comfortable with going back so soon. Like, I didn't even get a chance to prepare. Like, what is happening? But literally seeing my patients come in and say, I know it's a pandemic, but I'm still fighting for my life. I want my treatment. I showed up. I'm like, if you can show up for this, I can show up for you. So let's do it. Like, you're here. Let's make it happen. Because we had plenty of people call and say, I'm not willing to come out. I'm too afraid, whatever. But we still had that core group of people who are like, I want my treatment. I want to live and I want to fight. So I'm like, if you're here, I got your back. Let's do it. Let's fight together. So we made it happen.
That's awesome.
And similar to Sherelle, for me, it's at an FQHC, I'm the safety net. So when they come in there, there's nowhere else that they're going to be able to go. So if they're brave enough, like Sherelle said, to come in, and many of them, it's been a tough road to even get them to come in and to fight through all of the social determinants in order to get the treatments that they need and move forward in their journey toward their own optimal health. If they're willing to fight, I'm willing to fight with them. So it's not harder. It's definitely a calling. And I always tell them, if you don't give up on me, I'm not going to give up on you.
Hey, we're talking with Black Doctor Speak. We're talking with nurses who are on the front lines of the coronavirus epidemic. If you have questions, I think we can take a few somewhere along the line, although this is a very, very serious and stimulating conversation to see all three of you invest in yourselves. One of the things that I want to skip a few the regular questions and ask you, you're in the hospital more now than you've ever been, or you've been involved with your patients more now. Have you seen a difference in how African American patients are treated as opposed to other patients in this pandemic? I think that's an important issue for us.
So I will say, because like I said, the past time I was in Laredo, so it was a lot of Hispanics. But before that, I was at Emory in Atlanta, Georgia. And I will say that I do see a difference with people of color and people that are not of color. And that's why I feel like it's so important for African Americans to be in the medical field. We need Black doctors, we need Black nurses, we need Black surgeons. Like, we need that, because it's also a disconnect, because I can look on, I can see the look on my patient's face when they don't know what's going on. They don't know what you're talking about. They don't know what the treatment you're saying, these drugs. They don't understand anything that's going on. And instead of them saying, I don't understand, they're either going to nod their head or just say, okay.
Mm-hmm.
And a doctor is going to say, okay, cool, moving on. And so I make it my business to go back to my patient and be like, hey, in layman's terms, did you understand what was going on? And they will be like, oh my gosh, thank you so much for coming back. Whereas, like, it's sad to say, but our people don't have the resources like Caucasian people do. They have pharmacists and surgeons and all these people that are calling like, hey, like, I have family members who like, yeah, I'm in intensivist at this hospital. Can you explain to me what the vent settings are for this and this and that and that? And you don't have that for Black people. You don't have that for Hispanic people. So there is a difference, and the doctor will sit down and talk to a family member that understands their terminology. But when it comes to a Black mom who's like, I don't know what's going on, they'll just give them a bunch of stuff over the phone, and then the mom will call back and be like, I didn't understand. So it's definitely a disconnect there that we have to fix for real.
And I've also found as well that patients, so there's obviously the disparity between people of color and people not of color in medicine, right? But I've also found that patients of color don't feel as comfortable asking questions. Mm-hmm. So like Alex, you said, so they'll see the oncologist before me and he'll say, okay, You progress, we're going to put you on this treatment, da, 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 da. And they're like, great. Then they'll come see me the next visit and they're like, I have no idea what's going on. What is this? What kind of like, I've even had patients say like, I know I have breast cancer, but that's it. And I'm like, oh, so we need to talk about staging and hormone receptors and everything from the very beginning. And I've even had patients say, okay, so I know he said he wanted me to get the vaccine, but what do you think? And I'm like, okay, let's talk. And so it's a lot easier for them to accept information and even to ask me questions. They feel a lot more comfortable asking questions from someone who looks like them. And they're like, okay, you broke it down, you made it make sense, and I feel okay with accepting that from you because you look like me. So that's, like you said, that's another reason that having people of color in these spaces is so important, because people just don't know. And my grandmother was recently diagnosed with cancer at the end of 2020. And even with my own family, like I've been asking questions like, what is this? What is that? And my family has no clue. They have no idea where to even start. And I'm like, wow, I'm a healthcare professional in the family. Like, imagine people who don't have anyone medical in their family and they have no one to turn to ask those questions. So it's almost kind of scary to think that there are people out here who really have no clue as to what's going on. So I make it my mission. Not that I say I don't spend as much time with people not of color, places like that, anything like that, but I make sure to ask, like, do you get it? Do you understand? Or do you have any other questions? Like, he's not here. It's just me and you. We got time. Let's talk.
Mm-hmm. That's awesome. That's great.
And like Sherelle and Alex, I spend a lot of my time in that patient room providing education. And many times I will see that they've had a diagnosis for 7 years and they don't understand what was even going on and why and what medication does what. So in that 15 minutes I get per patient, I tend to extend that quite a bit just to make sure they understand, because a lot of times I've found that if they understand the how and the why, they feel a lot more comfortable with the what. So that extends to the vaccine conversation. So I spend some time like breaking it down into layman's terms, the science behind it and why it works and what the how we term them, the side effects from the vaccine. But if I think about it, it is evidence that immunity is being built. Mm-hmm. So if in fact you have these symptoms, it means it's working. So sometimes that conversation and just that twist helps them in taking the time to do it. So a lot of times, not necessarily all the time for sure, but a lot of times the information is rushed through because we don't have that much time per patient. And if there are some background beliefs that, well, they don't really care, they're not that smart or what have you, people don't spend the time. And I found that our patients absolutely do care about their health. And there are a lot of factors going into what they do or what they don't do or what they believe and what they don't believe. And just taking the time to listen to what they're saying and what they're not saying. And then appropriately and step-by-step educate them, and just take the time to continuously do that. This stuff is not that easy to understand all the time. Some of these things are super complex. So just investing the time, I found that it really works wonders. And that may be some of the difference that I see.
Mm-hmm. Well, one of the things we founded, the African American Wellness Project, was the rage that some of us had at the way Black people were treated in the healthcare system. And one of the things that and I don't want to harp on it too long, that the African American Wellness Project website has is how to take advantage of the healthcare system. You got to have an advocate, let's face it.
Absolutely.
If you have a chronic disease and you don't have an advocate, you're up the creek. Mm-hmm. So consequently, that's why we're here every week, trying to get people to understand it's not just about the illness, it's about the way the system handles you when you have the illness. Dr. Donna?
Yeah, it's absolutely true. My show, my whole theme is generational health, right? And that starts with building right where we are, this generation, getting us to be healthy, and then allowing that to pass to successive generations. Just like we talk about generational wealth, we need to start talking about generational health. So, representation matters. It matters when I walk into the room as a Black doctor. It matters when you walk into the room as a Black nurse, and it matters what we do. So we talked about vaccines. So tell me, have you all gotten the vaccine?
Hey, this is where the rubber is.
This is the truth serum.
The road.
Okay, so
I mean, everybody's leaning in now. They're like,
This is where the rubber hits the road.
I personally have not received the vaccine yet, but only because, so like I said, I am a travel nurse, and I was in Laredo, and they did offer us a vaccine, but I want to get both of my vaccines in the same place. So, you have to wait 21 days until you can get the second vaccine. So I was finishing up my contract. I spent 2 months in Laredo. So I would have been gone by the time it would have been time for my second vaccine. And I was like, I don't want to be somewhere and I can't get my hand on the second vaccine. And then I'm freaking out like, oh my gosh, I only got the first vaccine. I didn't get the second one. What's going to happen? Like, oh, Jesus. So I said, I'm going to just go ahead and wait. But I do plan to get the vaccine for sure, 100%. I also encourage everyone out there, if you can, get the vaccine. Like Sherelle said, the patients who are immunocompromised, with cancer and stuff, their doctors are telling them, listen, get the vaccine. You can put alcohol in your body. You can drink your wine, your Hennessy. You need to get the vaccine. Okay? That's how I look at it.
Exactly. And that's a great point too, Alex, is that, there are multiple vaccines out there, right? We have 2 vaccines that are approved. We have one probably going to be approved in another week or so. But it is important that both doses have to be of the same vaccine. So it is important that it was smart of you, actually, Alex, to say, let me wait so I can get both doses at the same place to make sure that I'm going to get both Pfizer or both Moderna, because you can't get one Pfizer and one Moderna and have the same known efficacy. Not saying it won't work, but the studies are 2 doses of the same vaccine. So it's really important. That's an important point. Sherelle, what about you?
Wait. Did I feel some kind of way that she just alcohol shamed us?
She just said
In no shape or form shaming anyone.
Alex.
I love my
You alcohol shamed. You alcohol shamed. Just own it.
After work to wind down. But it's for me, people say, oh no, I'm not going to get that vaccine. It's going to make me for a third leg, or I'm going to get a 6th an 11th big toe. But you in the club drinking.
You do know I have the button. I can mute you and I can pull you.
Alex!
Well, go ahead. Please tell us, Sherelle. We're moving on. I just got trained like that. All these people watching and everything. We're supposed to have a conversation. We're supposed to be cool, Alex. Moving on. Sherelle, have you taken the vaccine?
You're muted, Sherelle. There you go.
Okay, there we go. I will be honest and say initially I was like, I'm not gonna get the vaccine. It's not enough research. But I have read up on it a little bit more. I'm a little bit more comfortable with it now. And so what I wanted to do initially before getting the vaccine was see if I had any antibodies. Because we're going in the room with patients now. So I'm like, I'm 100% sure I've been exposed to it in some shape or form. So I just want to see if I have antibodies. Actually found out on Friday that I am antibody positive. So I was like, okay, cool. But I have resolved that I'm going to get the vaccine. I have reached out to my manager. I'm on the list for the vaccine. And so Health should be reaching out to me some point this week to go ahead and get set up to get vaccinated. So I'm going to do it.
Great. We don't know how long those antibodies from natural infection are actually going to last. So it is really important, even if you have antibodies, even if you've already had coronavirus, that you still do get the vaccine, because we're not quite sure how long those antibodies are going to last in your body and actually be protective. So good job, Sherelle.
Sounds like I can't tell my patients, like, we're team vaccine, you need to get it. And then they say, well, are you going to get it? And I'm like, I'm like, I can't do that. I have to take the vaccine. So I'm going to do it. I'm going to do it.
Great.
Good stuff. And like I said before, I've had the first dose. of the vaccine, and first dose, I had a really sore arm, kind of like a tetanus vaccine, but that resolved. It didn't keep me from my workouts, so sad to say, some of my Facebook friends were like, I would like for you to change that and say I could not work out, but I absolutely could. So my second vaccine is due at the end of next week. So I will let y'all know how that goes. But like Sherelle, like Alex, I want to walk the talk. And I feel very uncomfortable telling my patients or advising them or encouraging them to do something that I wouldn't do. So I want to protect myself. I want to protect my family. I want to protect my patients. I want to protect the people who cannot protect themselves. So I'm team vaccine.
All right. All right.
Yeah, I've had the second vaccine. And I think there's a little bit more juice in that second one. I have never had any problems with vaccines, and I had no problem with the first one. And I didn't have any local reactions with the second one, but I think I was a little bit tired. That's not a word. And I think that I kind of felt that something different was happening. But today I feel perfectly normal. A couple of more personal issues with nursing. Now, I live with a nurse. That's not easy. You have to live with a nurse. When they're angels of mercy and all that. If you live with them, you understand what it takes to be a nurse and what you understand what it takes to be a Black nurse. I know each of you has encountered in your career either physicians or systems that you knew were discriminatory and didn't really meet the needs of the patients you were most concerned about. One of the things we're really concerned about, Sherelle, is that so many people are not getting their regular screenings for cancer and not going for their treatments. But how do you keep, even with doctors all the time and systems all, how do you keep them in line as an African American? I know how I'm kept in line. You keep other people in line.
I have been blessed with a very receptive supervising physician. So I will go to him some days, and he knows when I come into the office and close the door, he's like, uh-oh. And I'm like, listen, we need to do this, this, and this. This is where you messed up. Like, this is what's going on type of thing. And he's like, oh, wow. Like, I didn't even realize that, or I didn't even know. I've had some encounters with physicians who weren't the most respectful. And you just have to say, listen, I understand your position as well as mine, but however, I'm a human being just as you are, and we're going to be respectful. So let's calm down, and then we can resume the conversation. So you just have to put your foot down.
All right.
I was listening to Sherelle, and I thought about a conversation that I had when I worked in the medical intensive care unit here at a level 1 trauma center. And I was joking around with the medical director of the ICU and, saying, oh, you know what, I'm nice. I'm, not mean or whatever. He said, yeah, but I know if I get between you and some patient care, it's going down. and he's absolutely right. I try and just keep people aware of the little nuances that make a huge difference in our patient outcomes. Because in my heart of hearts, I don't believe anybody in this field, in this profession, wants to go in and have our patients have poor outcomes. So white, Black, what have you, I do believe that they want the best outcomes. But sometimes I don't think that they understand that there are minor things to them or things that go unnoticed that may really impact the patient's understanding. I don't like to say a compliance or adherence or what have you to a specific treatment plan, and therefore their outcomes. So I just try to encourage people to listen to what's being said and listen to what's not being said, and take the time to step into someone else's shoes. There are a lot of things that I say, it took a lot for this patient just to get in this door today. So the last thing we want to do is us be the reason that they walk out and don't come back and experience poor health as a result. So that's how I address it. And if there's anything I see systemic in the organization, I am not real shy about bringing it up in our provider meetings and our all staff meetings. So from the CFO down, they know I'm asking for the data and the numbers all the time, just to see if there's a systemic change that can be made that will help with our follow-up, even that will produce better outcomes. If we think it should, go one way, but maybe our patients don't have access to that. So let's think out the box and go a different way. So that's how I try to address it. At any level I see it that we can kind of poke a hole in it. Let's go for it.
Alexandra, you've been in a lot of difficult places. I mean, you've been to the centers of a lot of these.
I don't know what's going on. I can't hear anything. So I'm going to try to leave and come back because I can't hear what you all are saying.
Anyway, so I know you've been in San Francisco and Laredo. I guess she's going to get off.
Yeah. She had a bad connection. She's going to try to log back in.
All right. Dr. Donna, you want to?
Well, no, I was just going to chime in and say, there's the saying, happy wife, happy life. Well, when you work in the hospital, it's happy nurse, happy life.
You're right.
Yeah, right. Especially I've learned that very quickly in my 24-hour shifts. Don't piss off that nurse right before I'm trying to go lay down. But you all are our eyes and our ears, and I so appreciate my nursing colleagues because you all are at the bedside. You see things that we may not be able to see. You pay attention to things that we may not think is important. And you really are the ones who are spending the majority of the time with the patient. We diagnose, we say this, we say that, and then we're out moving on to the next. But it's really the nurses who are sitting there getting all the information, learning about the family dynamics, understanding, what challenges that patient might have, and really being that patient's advocate. So I really love and appreciate nurses. So I just want to say thank you from all of us doctors who can be difficult, but not me.
I'm
bringing it in. We're giving a hug.
We're giving a hug.
I'm not going to disagree. Honestly, do you have any questions from people listening to our program that need to be answered?
We did. I think the main question, and it's been asked several times, has really just been about people wanting to get more specific information about the vaccine and can they take it. So we have some questions about people being immunocompromised. Can they take the vaccine when they can't take other vaccines? And so my immediate response as the non-medical professional here on the panel is to check with your doctor. But
you better check with your nurse.
But that's why we're here. So we have doctors here to answer those questions that they may feel uncomfortable in asking their own doctor, and they might not be able to feel comfortable, or they may not be seeing a doctor. And so that's why we have this show in this forum. So I'm going to throw it out to everybody here. If you are immunocompromised, can you still take the vaccine?
Well, I'm going to let the immunologist take the first crack at it. So go ahead, Dr. Mike.
Yes, I think you can. I mean, I think that immune compromised doesn't necessarily mean you cannot make positive responses. And in point of fact, in some of the research studies, they were looking for immune compromised patients to see if, in fact, the vaccine can be effective. Here's what people worry about. If you're immune compromised and you get the vaccine, will the vaccine go wild itself? It will not. You'll make some kind of reactions, but you just won't make the same quality of reaction that people who are not immune compromised. And one of the reasons for the vaccine is for people who are carrying the weight of other chronic diseases. And so I think that the recommendation is that you can give this vaccine to almost any patient and expect some kind of response. But the vaccine is not going to overtake your system simply because it's compromised.
Right. Great. I know we're running almost along on short on time. So before we allow our guests to leave, I want to just have them give a little background to like why they became a nurse. And as I'm looking at their titles, so we have Alexandra, BSN, RN, we have Sherelle, NP, we have Marcy, APRN, CNP. What the hell? What is all that? So I want you all to like explain what all of your wonderful letters are behind your name and how you got to be where you are.
I'll start because mine is the easiest. So, so I actually met Sherelle at FAMU. That is my sorority sister, and also my line sister. So, we both went to
Okay.
FAMU School of Nursing. So I have my bachelor's of science in nursing, and then basically the only difference is some people get their associate's degree, and if you just get your associate's degree and not your bachelor's, that's why you would have RN and not BSN. So that's one thing. I always wanted to be a nurse. My mom is a retired nurse anesthetist. So I am actually not following her footsteps. I am not applying to go to CRNA school, but y'all heard it here first. I am applying to go to psychiatric MP school in August. So I
Yay!
so yes, I'm going back to school in August. I've already sent
So
off my
needed.
application. So y'all just pray for me that I get into this
Yeah.
school. Okay.
Yes, so needed.
Um,
We so need mental health professionals that look like us.
yes,
Yes.
yes. So I'm going to psych MP school. But yes, I love helping people. I love making a difference. I love feeling appreciated, especially by doctors. So whoop whoop for y'all. But yes, it really just me making a difference in my patient's life and my family member's life, them appreciating me, me knowing that they will probably never forget me. You know, like Sherelle dealing with cancer patients, she sees the same patients all the time. You know, so it's like they never forget her face. You know, like years later down the line, people are gonna see me and be like, "Wow, you helped take care of," me," you know, and that just me being able to make a difference in someone's life. Like I will forever be grateful for that. So that's my spill.
Well, nursing kind of fell into my lap. So when I went to FAMU initially, I went with the intentions of being a pharmacist. So I'm working through my prereqs, and then I get to the semester that I have to take organic chemistry, and I was like, absolutely not. So I went to my counselor, and I was like, well, what else can I do with these prereqs and still graduate on time? Because I was on a scholarship and I didn't want to pay for any additional semesters. And she was like, oh, you can go to nursing school. And I was like, okay, well, I'll be a nurse. Cool. So show up the first day of nursing school, like, hey, y'all, we're going to get a syllabus, and then we're going to be out. And she's like, slides, they're taking notes. And I was like, I have no idea what I've gotten myself into, but okay. So make it through the program, start working. As I'm in nursing school, my mom got diagnosed with breast cancer. And so at the time we were going through clinicals, and every clinical rotation that I had, I just wasn't really feeling it. But I would go with my mom to some of her chemo appointments. And just like you were saying, Alex, to your point of you never forget faces and how those nurses made you feel, her nurses were absolutely amazing. Like they would literally be like, I know you said you had a test last week. How did it go? Or, you know, how are things going? I know you said you had a sorority event over the weekend. How did that go? And they were so just accommodating, and they were so nice and so understanding. And I was like, when I become a nurse, I want to make people feel like this. So when I graduated from nursing school, I got on to, I started working on the floor on a med-surg oncology unit, fell absolutely in love with it. So that's how I got my start in oncology. So I worked on the floor for a couple of years. I worked in an infusion center for a couple of years. And then when I graduated from MP school, I was granted the opportunity to actually work in a clinic, which now that I look back, all that experience has given me so much knowledge because I understand what it's like to be admitted, what it's like when you're in the infusion center, because I have patients who will come to me and they're like, I have no idea of anything to expect. So I'm like, well, when you get upstairs, this is what you can expect, because I worked as an infusion nurse before. So just being able to really be a part of people's lives, and I honestly feel like my mom's nurses saved my mom's life. So if I can in any way impact my patients' family members the way that my mom's nurses impacted me, then I know I'm doing something special. So that's how I ended up in nursing.
Well, I don't think we have enough time for my whole long story. So I'm going to try to wrap it up. But unlike Alex and Sherelle, I kind of took the long road home to nursing. In undergrad, I was actually a computer information systems major. So I have a bachelor's in computer information systems, worked as a systems analyst and programmer. Did not love that. Went back to school and got an MBA in finance. Did not love that. Worked in corporate finance for a while. And I found nursing. I had actually had nurse practitioners take care of me in the primary care setting. And I had good experiences. And actually, when I was living in the Bay Area, I explored, like, gosh, what would it take to become a nurse practitioner? And I was old then.
Never
can I even do this? And spoke with someone, got a chance to shadow, and it was actually, I got to shadow Dr. LeNoir's wife, and who is a nurse practitioner, and ended up so late in life, went to nursing school, worked in the ICU, and I promised my husband, okay, if I get another degree, I promise I'm going to this will not go to waste. It will not be on the shelf. It will not be on the wall, and I will not complete another degree in something I do not enjoy. So from the very first class to the very first day in clinicals to the very first day in the ICU, which is terrifying, to be very clear, but I felt like I was at home. And it was for sure my calling, and went on to become a nurse practitioner. And I love the opportunity to impact someone's life in such a significant way, and to make those connections. So that was my road to nursing. So the motto there is, if you're not dead, it's not too late.
That's right.
I know I'm going to pay for this, but I got into nursing after a couple of dinners. So
You really are going to pay for that.
Close my computer right now. I'm just going to close my computer.
Don't leave, Alice. Don't leave. Come back.
I know I'm going to pay for this, but hey, I just, everybody's up front.
It's off the rail.
I think we're about to run out of time. And really, I think one of the things that comes up is that we need Black nurses.
Yes.
I mean, we need Black nurses like we need Blacks in every area of healthcare. We need more Black doctors. But I do think the nurse plays a pivotal role in their intersection between the healthcare professionals and the patients.
Yes.
And I think that having Black nurses makes a tremendous difference in the culture of every single institute that I've ever been in. Also, it expresses a need that we at the African American Wellness Project, we also believe that you really need to know the system and you need to have advocates. And I think you've reinforced the commitment that we have. So I'd like to thank each of you, Alexandra, who's been in the most dangerous places in the country, Sherelle, who really is dealing with the most important aspects of specialty medicine, and certainly Marcy for her investment. I'd like to thank Dr. Donna for taking the time to stay with us. And Alice, thank you so much for putting together this program. But most of all, I'd like to thank those of you who've taken the time to join us here on this edition of Black Doctors Speak, the African American Wellness Project. I want you to remember that health is your biggest asset, so protect it.
Y'all take care.
Be great.